Didactic video for my final grade. I'm going to go ahead and scan the room. Okay. This is my patient J.E. I'm going to go ahead and inspect the skin, which appears clean and clear. There are several primary lesions on bilateral cheeks and on the nose. Hair is evenly distributed in normal male pattern distribution. There's no dryness. Hair is well hydrated. Eyebrows are symmetrical and normal hair distribution also on those. There are several primary lesions in the form of papules, a mole on the neck, and we're going to go ahead and inspect the eye. Sclera is white, iris is dark brown. I'm going to go ahead and ask you to just follow this, just look at this pen and follow it. Okay. And if you can cover your eye. Okay, and cover the other eye. Okay. I'm just going to use my ophthalmoscope to check for bilateral red reflex, which is noted. Optic disc and macula are also noted. Pupils were equal and reactive to light. No nystagmus was noted, and eyes were smooth in all fields of vision. I'm going to go ahead and talk about the Snellen chart for a minute. Snellen chart is to test for visual acuity with long distance, and that is a card that's held at 20 feet. The Rosenbaum test is a card to test near vision, and that's held 12 to 14 inches from the face. This patient tests for 20/20 vision with his corrective contact lenses. Okay, we're going to go ahead and inspect the nose. There's no drainage, there is no redness or irritation noted. Do you have any nosebleeds or?
No.
Okay. Just going to feel around the lacrimal gland and the paranasal. No swelling, no tenderness?
No.
Okay. We're going to go ahead and palpate the pre- and post-auricular nodes, the retropharyngeal, occipital, submandibular, submental, the deep cervical chain and superior cervical chain, and the subclavicular nodes. No swelling is noted. Is there any tenderness when I'm touching? Okay. No tenderness noted. When we inspect the ears, there's no masses or bulges, no drainage noted. When I take my otoscope and look in the bilateral ears, we're going to pull back and up and look in, and the tympanic membrane is gray and translucent and flat. There's no scarring noted, and the cone of light is also present, and that is with both bilateral ears. Okay, I'm going to just go grab some gloves real quick. Okay, and we're just going to note that your lips are pink, they're well hydrated, there's no dry skin noted. I'm going to ask you to do a couple tests. If you could blow out your cheeks and purse your lips, scrunch your eyes and your nose. Okay, close your eyes. All right. First, I'm going to have you stick your tongue out and move it from side to side. Okay, and that tests the hypoglossal. And I want you to, I'm just going to take my light here, stick out your tongue and say ah. And the uvula is midline and the soft palate does rise. And that tests the glossopharyngeal and the vagus nerve. Those are the 9, 10, 11, and 12 cranial nerves. No, I'm sorry, that's 9, 10, and 12, which is the glossopharyngeal, vagus, and hypoglossal. Okay, just open real quick. All right, the frenulum is noted on the top, superior, and on the posterior portion of the mouth. Just lift your tongue up if you can for me. And the frenulum is noted, as well as the Wharton's duct. We're going to go ahead and count the teeth. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28 teeth all together. Okay, no lesions noted. Buccal mucosa is pink. And no lesions, no open areas. That you have no tooth or mouth pain?
No.
No, okay. What we're going to do next is the corneal reflex. All right, just open your eyes real quick. Okay, and that is positive. Both eyes blink. And that tests the abducens nerve, which is the 5th cranial nerve. I want you to just tell me when you feel soft and sharp. I have a toothpick and a Q-tip here. Close your eyes and you just say soft or sharp when you feel.
Soft. Sharp. Soft. Sharp.
Okay. And that was within normal limits. Okay. I want you to block one nostril and close your eyes and tell me what you smell.
Mint.
Yep. And that's a peppermint oil. I want you to block the other nostril and tell me what you smell. Need to smell again?
Yeah. Lemon.
Yes. Lemon oil. And patient does have some congestion in his nose today. But there is no swelling or, let me grab my light real quick. No swelling or drainage noted, no lesions or anything of concern. Okay, I'm going to go ahead and just palpate the trachea. And as we move up, you can feel the cricoid process. Okay. Carotid pulses are felt bilaterally. There is no jugular vein distension. Can you open your jaw and close it? No popping, no TMJ. Can you move your jaw from side to side? And out and in? Okay. And can you smile and frown? Okay. The facial nerve has been tested, which is cranial nerve 6. I'm going to go ahead and palpate for the thyroid. If you could just turn your head to the right a little bit and put your chin down a tiny bit. Okay. Okay, and if you could turn the other way, left, and just put your chin down a little bit. And my left hand's able to displace so that my right hand can palpate. Okay. Okay, so now I'm going to go ahead, if you could just take your shirt off, and I'm going to have you turn around. See if I can get this set up a little better here. Okay. Maybe turn your chair towards the clock. Okay. All right, if you could say the words 99.
99, 99, 99, 99.
Okay, and tactile fremitus is felt bilaterally throughout. If you look at the skin on the thorax, there are some primary lesions in the form of macules on the top, a couple of papules in the form of moles on the posterior portion of the neck. The skin is clean and clear of any lesions or rashes. The skin is warm, turgor, it's well hydrated, no tenting noted, and that's on the back and also the upper extremities. There's no tenting noted. Normal male pattern hair distribution is noted. On the left upper arm, there is a primary lesion in the form of a papule and several macules scattered throughout on the lower bilateral arms. But again, skin is warm and well hydrated, no tenting noted. We're going to go ahead and assess the lungs, and we're going to start first by that inspection, and now we're going to palpate the muscles. Is there any soreness?
No.
No bulges felt. Back appears symmetric. Rise and fall with respirations is noted symmetric. So we're going to go ahead and just percuss here. Okay. And a resonance is heard throughout. I'm going to go ahead and auscultate. You can just breathe regularly. No adventitious breath sounds were heard, no wheezing, no rhonchi, no rales, all clear respirations bilaterally. I'm going to measure the diaphragmatic rise and fall. If you could just take a deep breath in and hold it when you're ready. Ready. Okay, you can breathe normal. Okay, I want you to take a deep breath and then exhale and hold when you're ready. Okay. And that's 4 centimeters, which is within normal, 3 to 5 centimeters. Okay, I'm going to have you turn around. Okay, and I'm just going to inspect the skin here. I know we did previously, but I'm just going to cover again real quick. There are several primary lesions on the anterior superior portion of the thorax in the form of freckles. Rise and fall of respirations is symmetric bilaterally on bilateral sides of the thorax. Upon palpation, skin is warm, skin is hydrated, no tenting noted. No bulging or masses noted. Is there any pain when I touch?
No.
Okay. Okay. Um, and you are able to see vessels on the surface of the skin. Um, Everything seems distributed symmetrically. I'm going to go ahead and oscillate the lung sounds. Okay. Again, lung sounds are clear and strong bilaterally. There's no wheezing, no adventitious breath sounds, no ronchi or rales heard. Do you have any difficulty breathing or pain with breathing?
No.
No. Okay. I'm going to go ahead and listen to the heart on the second intercostal space on the left side of the sternum, and on the right side we have the aortic and pulmonic. So I'm going to go ahead and listen to those. Aortic. Just breathe regular. Erb's point is at the third intercostal space. We have the mitral valve and the apical. Okay. S1 and S2 sounds are heard. No murmurs. S3 or S4 are noted. I'm going to go ahead and listen to the carotid arteries one more time. No bruits heard bilaterally. Okay, and no jugular vein distension noted. Pulses where the carotids are located are noted, which is normal. So as I said with the cardiac, there is no murmurs, no S3 or S4 sounds. Heart rate regular, strong. Going to have you, let's see. No edema noted. Also in the bilateral lower extremities, normal male pattern hair distribution. Several primary lesions in the form of macules noted on both lower extremities. No edema, no tenting, no bulging or masses noted. Skin is hydrated, warm, no dryness noted. So we're going to go ahead and have the patient lay down, and we're going to assess his abdomen. Alright. Okay. Just relax, lay down. Okay. Some pulses noted here, which is normal. No bulging or masses. Any tenderness when I press in?
No.
Or let out?
No.
So that's a negative Brumberg's test. We're going to go ahead and oscillate for bowel sounds. positive bowel sounds in all 4 quadrants. No bruits heard on the iliac or renals. Femorals were deferred. I'm going to go ahead and percuss over the abdomen. And could you cough, please? Okay. I'm able to feel the posterior portion of the liver when he coughs, and it's smooth, no ridging, no pain upon palpation?
No.
No. Okay. I heard resonance throughout with percussion, which is good. We don't want to hear any dullness, especially over here. This is where the spleen is, which we are unable to palpate, which is good, because if we were able to palpate, that would mean it was enlarged. So the spleen is tucked in and under and where it's supposed to be. There was some dullness over the bladder region, which just means it's partially full, but the rest of the abdomen has a resonant sound upon percussion. We're going to go ahead and measure the liver now. Let's see. I'm just going to come over on this side. All right. And we have 5.5 there, which is normal. Normal is, I think it's 5 to 10. Okay, so the liver is not enlarged. I'm going to go ahead and just have you kind of just, yep, all right. No pain?
No.
So we're just palpating for the kidneys bilaterally. We were able to palpate the liver. And the spleen was not palpable because it's tucked in where it's supposed to be. Okay. All right. Now let's see. I'm going to have you just sit up real quick. I want to just do a quick ear test. So I'm going to whisper something in your ear, and I want you to tell me what I said. Okay?
Basketball, baseball, tennis.
Okay. I'm going to go ahead and test your ears with this tuning fork. I just want you to tell me when you hear the sound stop. We're going to start with the Weber's test. Oh, hang on.
Stop.
Okay. You still hearing it?
Stop.
Okay.
Stop.
So that's the Rhine test, which seemed to be half of what the Weber test was. We're going to go ahead and do the other ear if you just want to face this way. Okay? And just tell me when you hear it stop.
Stop.
You can go ahead and face me again, and I'm going to have you lay down. We're going to do some exercises.
Back.
Yep. Okay. I want you to take one leg, bend your knee, and bring it up to your chest. Okay? And then extend. Okay? And go ahead and do the same with the other leg. Flex back to your chest and extend. Okay. And you can put your leg down. I'm going to go ahead and have you kind of take this heel and put it across on your knee like you're sitting. Yep. And do the same with the other leg. Okay. All right. And then I'm going to have you put your leg back down. Okay. I'm going to have you point your toes down. That's plantar flexion. And point your toes back up towards you. Dorsiflexion. Okay. I want you to kind of roll your ankles. Rotation. If you could kind of put your foot in for inversion and then point it out. Yep, eversion. And do that with the other foot as well. Yep. Okay. All right, I want you to go ahead and lift your leg. Yep. And do it again against my resistance. Okay. And this leg. Okay. All right, now I'm going to have you go ahead and stand up and walk to the doorway. And I want you to come back walking toe to heel or heel to toe. Okay, very good. Let me try to set this up right here. Okay, and you can stand regularly. All right, I'm going to have you take one leg and bring it out to the side for abduction. And then cross it over the other leg for adduction. And do the same with the other leg. Abduction, adduction. So cross it over the other leg. There you go. Okay, very good. I want to have you kind of, if you can stand like this and put your foot behind you. That's hyperextension. Let's see if I can get a better view here. Hyperextension. And the other leg. Just kind of, yep. Very good. Hyperextension. Okay. So now I'm going to have you bring your arms out and over your head, kind of like you're diving. Okay. And back down like this for adduction. Okay. I want you to bring your arms behind your head. Okay. And then back down like this for internal and external rotation. Okay. I want you to make a muscle. Okay. And go ahead and put your arms back down by your sides. If you could hold your arms out like this for me. Okay. And take your wrists and point them down. Flexion, extension, and hyperextension. Okay. And point back down and against my resistance. Okay. All right. And I want you to do the same with your fingers. If you could flex down and then extend and then hyperextend. And do the same against my resistance. Down, extend, hyperextend. I want you to squeeze both my hands with all your might and grasp is equal and strong bilaterally. I want you to take each finger and touch your thumb with it. Okay. Very good. I want you to interlock your fingers with mine and squeeze. Okay. And strength is equal bilaterally. I'm going to have you put your arms out and touch your nose. Okay. Both arms. And I want you to close your eyes and do the same. Okay. All right. I want you to put your arms by your side. All right. And just relax. Okay. Close your eyes. Okay. And negative Romberg's test. Light swaying, but patient was able to stand. No risk of falling there. Okay. So I'm going to have you touch your toes. Okay. Spine is midline. There's no swaying either way. No lordosis or kyphosis. Everything here is symmetric. You can stand back up. I want you to put your hands on your hips. I want you to laterally bend. Okay, I want you to rotate. Okay, very good. I want you to look at me with, just look at me, and then I want you to rotate your neck. Okay. Turn laterally. Okay, and against my resistance. And touch your chin down, flexion, up, extension, hyperextension. Okay, very good. Okay. I'm going to have you take a seat. Right there is fine. Okay. See if I can get a better angle here. All right. You can put your shirt back on, wherever that is. Okay. I'm going to have you close your eyes, and I want you to say up, down, or neutral, whichever way you feel me point your finger.
Down. Neutral. Up. Down. Up. Neutral.
All right, and we're going to do the same with your toes. Okay?
Up. Down. Neutral.
Okay, very good. Okay, I'm going to take a sharp and soft object, and I just want you to tell me where you feel it and whether it's sharp or dull. Okay, so just close your eyes.
Dull on my right arm. Sharp on my left forearm. Sharp on my right shin. I didn't put that one. Sharp on my left shin.
Okay, very good. And that was within normal limits. Okay, I'm going to test stereognosis and graphesthesia. If you want to close your eyes and tell me what number you feel me drawing in your hand.
An 8. A 3.
Okay. I want you to go ahead and tell me what you feel. What object?
It's a pin, a safety pin.
Yes. And that's within normal limits. I'm going to ask you to count to 10 backwards.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Can you tell me what the saying "a stitch in time saves 9" means?
Yeah, it means if you don't take care of something now, down the road it's become a bigger problem.
Okay. Can you tell me what your date of birth is?
February 19th, 1987.
And what year we're in?
2015.
And who's the president?
Obama.
Okay. And that's all within normal limits. Okay. I'm going to go ahead and test your reflexes. We'll start with your tricep here. Okay, I'm going to have you sit over there actually, yeah. And if you could get on your knees right here and just kind of let your ankles hang off the back. Okay. So we were able to check the popliteal, the Achilles, the brachioradial, the tricep. All the reflex were tested and all were +1. And let's go ahead. If you could just take your shirt off one more time and lay down. I did want to remember to just do a quick breast exam. Okay. We did palpate before, but I didn't note it verbally, so I just wanted to say bilaterally there's no masses, there's no discharge. As we palpate into the talus fence, there are no masses or nodules, and like I said, no discharge bilaterally. Okay, you can get back up. And you have no tenderness or pain?
None.
Okay. All right. Let's see. could stand and take your heel and rub it down your shin. All the way down to your ankle just once. Oh. And do the other side. Okay, very good. And you can have a seat. Okay. So, throughout this head-to-toe assessment, we did check the cranial nerves. The olfactory, cranial nerve number 1. Cranial nerve number 2 is the optic. 3 is the ocular motor. 4 is the trochlear. 5 is the trigeminal. 6 is the facial. Abducens is the 7. 6 is the abducens, 7 is the facial. Vestibulocochlear is 8. Glossopharyngeal is 9. 10 is the vagus, and 11 is the spinal accessory, and 12 is the hypoglossal. Let's go ahead and check the spinal accessory. If you could shrug your shoulders. Alright, and then against resistance. Okay, very good. Alright, I'm going to just check some of your joints. First, I'm going to palpate them. No swelling noted. And just tell me if you feel any pain.
No, no pain.
Okay, yes, and
No.
no swelling is noted. I'm going to go ahead and have you tell me when you stop feeling the vibration. I'm going to put this on one of your joints, and when you stop feeling the vibration, let me know.
Stop. Stop. Stop.
Okay. Okay. I want you to tell me when you feel 2 points or 1.
1, 2, 2, 1, 1,
Okay.
1, 2, 1,
Okay.
2, 2, 1.
Okay, and that's within normal limits. Okay. So, I believe we covered everything. We did inspect the nails, which capillary refill is normal, less than 3 seconds. The nails are smooth and without ridging. No clubbing noted. Also on the toes, no clubbing. Nails are smooth, no ridges. I'm going to go ahead and palpate for the pulses before we end. So I'm just going to palpate again the carotid, one at a time. Okay. Brachial. Radial. We'll defer the femoral and move right onto the popliteal. Just keep your the tibial on the medial aspect near the heel. And the dorsalis. And that's noted. Okay, I think that completes our head to toe.
Thank you.